what to feed your baby in the first year, things you should know about, and things to avoid. These are the top misconceptions I've seen as a pediatrician, and I'm going to talk about them with you so you can avoid them at home. Hi guys, it's Dr. Eileen. I'm a board certified pediatrician here to talk to you guys about the most commonly discussed topics in pediatrics. I like to go over some of the things we talk about in detail, about the questions that we have, concerns that parents have that you may not have the time or the ability to cover fully at your child's doctor visit. So let's get started. Number one, breast milk is not the only option. Now you've heard it from me. I will tell you that breast milk is the best for your baby because it's the most natural. There's so many good benefits to breastfeeding your baby, but it is not the only option. I have to say this because parents come in and they get so stressed out because they're having such a hard time feeding your baby. In the whole scheme of things, the things I'm focusing on when I'm examining your child for his or her health, I'm looking at weight gain. Is the baby gaining weight? Is the baby feeding? How is the dynamic between the family, the parent, the mom, and the child? And is breastfeeding really working? And sometimes it's not working for whatever reason. Not every mom can breastfeed effectively so that baby is growing well. And I really want you guys to hear it, to not take it to your heart that you are doing or failing your baby, you're doing something wrong, because you're not. Breast milk is absolutely the best for your baby, but it is not always an option for everybody. Sometimes you might have a really easy time feeding your baby, but some moms have a really hard time, and that could be due to many factors. What I want you guys to know is that if you're not breastfeeding your baby, formulas, infant formulas are highly regulated, and they offer the nutrition that your baby needs to grow. So they are great options. Go ahead and use them. That's what formulas are there for. Don't take it too hard on yourself that you're failing as a mother, as parents, if you're unable to provide breast milk. So formula is always an option. Breast milk is not the only option. Number two, I should not wake my baby up to feed because my baby is sleeping. Now that is a no-no and when your child is a newborn, say the first few weeks of life, because babies, when they're so young and so little, they really need nutrition every few hours so that their blood sugar doesn't dip. In the beginning, the first week of life, your baby may be kind of sluggish, kind of tired. They prefer to be sleeping, and most of the time they are sleeping, but you do want to wake up your baby at least every 4 hours so that they are getting some nutrition and their blood sugar is not dropping too low. Now, as your baby gets a little bit older, say 5 weeks, 6 weeks, or even 8 weeks, their bodies are able to handle long periods of fasting like we do as adults. They can handle a little bit better so their blood sugar won't drop if you don't feed. So talk to your pediatrician because it's based on a case-by-case cases, because sometimes if your child is feeding very well and they're gaining weight really well, some babies can go longer periods without feeding a little bit sooner than say 8 weeks, but in general every 4 hours for a newborn, it is the max amount of time that I would recommend that parents will go before they feed their child again. It may mean that you have to tickle their toes, wake them up, rub their back, and so to awaken them from their sleep so they're able to eat. But yes, you do want to feed your baby and wake them up if they're sleeping, especially in the newborn phase. Number three, a lot of parents think that my baby may be lactose intolerant. How do you know your baby is lactose intolerant? I think we're going to talk about this also in conjunction with milk protein allergy, which is a lot more common than lactose intolerance. So when you're an adult population, yes, there are quite a few people that are lactose intolerant because lactose is a milk sugar, and as you get older, past the infancy age, we start to lose that enzyme that has the ability to digest and break down lactose. So as you get older, more and more people do tend to have some degree of lactose intolerance. And that you can tell when your baby is very bloated, they have pain immediately after eating milk or eating very heavy dairy products. So you can see that correlation. Now, I want to talk to you guys a little bit about milk protein allergy and what exactly is that. Milk protein allergy is when your baby has an allergy to the milk protein. So almost all formulas are made with milk protein. They have whey and they have casein. Those are kind of the buildup of the milk protein in the formula. There is a group of population of babies that have allergy to milk. So it really is a food allergy. How would that look like? It may mean that your child will have some kind of foul smelling stool every time they stool. They're not only going to have diarrhea, but the key thing that I'm looking for is current jelly stool. So it looks kind of dark reddish. It looks like jelly, so kind of mucousy. So that's something to look for. That might cue you into thinking that your child has milk protein allergy. Also, if your child is not gaining weight well, or they're eating and they're often vomiting, or they seem to be in a lot of pain every time they drink or eat. And those are all things that would make me think and consider milk protein allergy, but not the only thing. So when you're considering that your child has milk protein allergy, always talk to your pediatrician. Oftentimes I see parents jumping in to try a different formula, like soy formula, thinking that that will fix the milk protein allergy. I get the thought process there, but babies who are allergic to milk protein allergy, there's also a huge overlap too. So about 40% of the kids who are allergic to milk protein allergy are also allergic to the soy protein. So switching from milk protein to soy, thinking that you're avoiding the milk protein problem, is not always a solution. So remember that and speak with your pediatrician before you make any transition. By the way, if you have found anything helpful in this video, please give it a like and subscribe so that you can be notified for my new videos. Number 4, does my baby need water? So generally, your baby does not need water in the first 6 months of life, and this is why. In the first 6 months of life, your baby is growing tremendously. They need a lot of nutrition that usually comes in the form of breast milk or formula. So both of these are already liquid formulas and liquid that they're drinking. So if your baby's eating enough to gain weight and to thrive, they should be gaining enough and getting enough water in their day-to-day, because breast milk has water and formula has water. They should be getting enough water to grow. You don't need to supplement more water, because we worry that when you're filling your baby's belly up with water, they're getting too full and they're not having enough room to really grow, to eat formula and milk that actually has nutrition they need to grow. So wait till after 6 months to introduce your baby water. Number 5, on that same line, I want you guys to start offering a sippy cup for your baby at 6 months. So when you're starting the water, go ahead and give the water in a sippy cup. Why? It's so that they're getting used to drinking from a different kind of mouthpiece other than the nipple. So they're getting used to a different kind of feel, because eventually after 1, the gold standard is to wean your baby off nipples and bottles totally. Number 6 is, when can I start my baby on solids or purees? So generally for breastfed babies, it is recommended by the American Academy of Pediatrics to breastfeed your baby exclusively for the first 6 months of life, because breast milk carries all the nutrition that the baby technically needs. However, if you're doing a little mix of that, breastfeeding formula, or just totally formula feeding, your pediatrician will probably tell you guys to start as early as 4 months. What we're adding when you're first starting your baby on food would be some purees or maybe some iron fortified cereal. So they're getting that extra nutrition that may not be totally complete that you would get from breast milk. So generally speaking, formula-fed babies start solids around 4 months of age, and exclusively breastfed babies may start solids a little bit later. However, if your baby is showing that they're ready to eat, like they're able to hold on to things and feed themselves food with their hands, or they're able to sit up and hold their head up, if they're showing you general interest that they're wanting to eat what you're eating during mealtime, or they're not constantly doing the thrusting of their tongue reflex, then they're showing you perhaps they're ready to start a little bit earlier. So there's no definite cutoff where you have to start or you can't start food until a certain age, but generally that is the thought process. Breastfed babies can start food a little bit later. Formula-fed babies start around 4 to 6 months if they're showing readiness to eat. Number 7, So I started my baby on solids, but how many times, how do I feed my baby solids? Generally, when you're just starting your baby on food, the first couple months, you're just trying to get your baby used to eating complementary feeds. That means that the food that they're eating, the solids, is not making up the bulk of their nutrition, because they should still be drinking formula or breast milk to get most of their nutrition. So the solids and the feeding times is really just about once or twice a day, depending on how your baby do with the feedings. As they get a little bit older, by 8 to 9 months, you should really kind of start eating a little bit more. So about 3 meals a day. You can start with a spoonful and see how your baby does. And if she or he is doing pretty well, then you can feed up to 2 to 4 ounces with each feeding. But remember, at this time, we're still kind of relying on formula and breast milk as a basis of our nutrition. But as your baby starts to eat more after 9 months, you're going to notice that at that time, their milk amount is not really going up anymore. It's really that the food that's going up to meet most of their nutritional demands. Number 8, when should I start my baby on yogurt, milk, or cheese? So this is a common question that causes a lot of confusion, because generally I say that yogurt and cheese are generally okay to start after 6 months of age, but you may want to wait a little bit later, like 1 year of age, before you introduce milk. Why is that? They're all dairy. Well, the reason is that yogurt and cheese are both cultured. They go through this culturing process that makes the milk enzyme or milk protein more digestible. They also carry, especially yogurt, probiotics that helps your baby's gut. So generally it's recommended after 6 months of age, you can start yogurt and some cheese products, but wait till after 1 year of age to start milk. We wait till 1 year of age to start milk because up to 1 year of age, you're getting more of that nutrition from their infant formula or from breast milk. So since we're weaning the formula off by 1 year of age, at 1, you can introduce milk that will have some of the nutrition and vitamins that they need to thrive. Number 9, should I start my baby on probiotics? Well, there are some research that shows that probiotics generally improves gut health, especially in the adult population and children. But for young infants, there's not enough study to really show a very strong evidence for the need and the benefits of having probiotics added to your child's diet when they're under 1 year of age. I think if you're already giving your child a vitamin D drop that has probiotics, is generally okay. I don't think that having too much probiotics is going to be too harmful, but the verdict is still out. So use at your own caution and speak with your pediatrician. The next topic is, why can't I give my baby honey until 1 year of age? So honey is one of those products that contain bacteria that can cause severe illness in a baby when given at a young age. This bacteria can cause infant botulism when given to a child below 1 year of age, mainly because at a young age in your baby, their intestinal barriers are still pretty penetrable and vulnerable to the attack of the bacteria. As your child gets a little bit older, their stomach and intestinal linings become stronger so that there's a stronger barrier. Even if you are eating honey, the bacteria is not able to penetrate through the intestinal wall to cause those kind of systemic toxicity or illnesses. So prior to 1, if you do want to give a natural sweetener to your child, I recommend to stay away from honey, but you can try agave, you can try molasses. Those are all good options to try under 1 year of age. And lastly, vitamin D. Vitamin D supplement is absolutely necessary if you are breastfeeding your child exclusively in the first year of life. If at some point that you're giving your baby more formula, mostly formula and just a little bit breast milk, then vitamin D is not so much needed for supplementation because formula already has vitamin D added to them. However, if you are mainly breastfeeding and moms, then I would definitely recommend keeping that vitamin D on until you transition your child to whole milk at 1 year of age. And there you have it, you guys. These are some of the guidelines that I want every parent to know when it comes to feeding your child in his or her first year of life. I do have other videos that you might find helpful when it comes to feeding your child or toddler. Please check these out here, and thank you again for tuning in. If you have any questions or comments about what we discussed, please feel free to leave a comment. Again, remember, everything that we discuss here is not diagnostic. It's meant to be educational to help empower you as a parent. Now, to make any big changes in your child's feeding, I always recommend speaking with your clinician and pediatrician before you make any definite changes. I hope this video is helpful. Stay tuned for the next one. Take care.